Good morning and welcome to The Point. It is Wednesday, December 23rd, 2020. Thank you to those of you joining us across the various GBN platforms. Always appreciate your listenership and your viewership and your time. Thank you so much. We're going to get right into it. This morning I have joining us is the Permanent Secretary in the Ministry of Health, Dr. Francis Martin, and he's here to provide us with an update in relation to Grenada's current COVID-19 situation, let's call it for now. Good morning, Doc.
Hi, morning to you and the listening public as well.
Good. It's been a while since we've had you on the program. Happy to have you back.
I know.
All right. It's busy days for the Ministry of Health, and it has gotten busier over the last week or so in relation to this current cluster. What's the update that you can provide? Just yesterday, I saw the news release of 2 additional cases.
Right.
Specifically, the one with the medical team, the member of the medical team, is that related to the cluster in any way?
This particular frontline worker has been with us from the beginning. And when I say front, I actually literally mean front, because they would go on to interface with COVID patients and everybody else in the field as well as within the clinics. So it is indeed related to the current situation that is going on. Because, of course, frontline workers interact with so many different people and so many different COVID patients it is not possible to lock that down to a specific individual. But because of the fact that frontline worker was workers who are swabbing COVID patients, then, of course, we believe that's where the exposure occurred.
Doc, I'm getting some light behind your shoulder. Can you shift a little bit, or maybe just lower your device to take out some of the room on top of your head? Let's see if that may work just a little bit. Still a little bit bright. Can you shift further? Shift is what? Yeah, shift is what? That may be a bit better. Possibly a little bit better.
I don't know if probably I should shift to a laptop and shift my position on the desk itself. So if you give me 5 minutes, I can reconnect in another location.
Okay, so let's give Doc 5 minutes, and in the meantime, we'll take a quick break. We want to ensure that you can see as well as hear the details that he is providing. This is To The Point with Acting Permanent Secretary in the Ministry of Health, Dr. Francis. Actually, that is better, Doc. That is better, actually.
It does have a tendency to go and come, that brightness that we're talking about.
Yes, the sun, because of the location of the window. No issues. Understood.
So let me still try to log on in a different location.
Okay, all right. So let Doc log on to the laptop. In the meantime, let's take a quick break, and then we're going to come back. This is To The Point.
The Grenada Food and Nutrition Council remind you to boost your immune system and give yourself a fighting chance against COVID-19. Consume foods that are rich in vitamin C, like fruits and vegetables. For example, oranges, grapefruit, mandarin, lemon, spinach, cabbage, and tomatoes. Vitamin B6 and folic acid that is found in chicken, turkey, fish, grain foods like oats, bread, local provisions, dry beans, and peas. Another immune system booster is vitamin E, found in nuts, corn, sunflower or canola oils, and leafy vegetables like spinach, broccoli, and kale. Iron, zinc, and vitamin D are also important important to strengthen your immunity. So try foods like lean meats, eggs, lentils, mackerel, tuna, and jacks. Our local spices, ginger, clove, and turmeric, among others, can help decrease inflammation and support the immune system. Remember to practice safe food handling. A message from the Grenada Food and Nutrition Council, reminding you that a strong immune system is one of the best ways to fight COVID-19.
Stomp out careless or intentional.
Welcome back to The Point, speaking with Permanent Secretary in the Ministry of Health, Dr. Francis Martin, giving us an update on Grenada's current COVID-19. Okay, so Doc, that explains, well, not that explains, but before we took the break, you explained the member of the medical team that got infected. The second case announced yesterday, a traveler from the United Kingdom. I know this flight came in prior to the ban on flights from the United Kingdom, but I am wondering, how is it that that person is positive? Do we know from whence the infection came?
Right. That's always going to be a challenge with people who travel into the country. They'll get negative PCRs for coming in. But we always knew that a negative PCR is only as good as the moment in which the tests were taken. And actually, that person could have contracted the infection after they've actually done that test. So it is a mechanism that has proven to be working, in the sense that we check people at the border and get their positivity. We will not be able to tell when that person got infected. And we do hope that it is not the new strain, because I think that is what is on the mind of everyone now, with anybody coming from England, whether or not we're going to be facing that new strain. It's still too early to tell. And my hope is that it's not, but you see, with epidemiology, you have to be prepared for anything.
Before we get into updates on the cases in the cluster, I saw a report from another media entity yesterday speaking of a flight that came in from the United Kingdom, which came, 2 days after the ban on flights. Can you shed some light on if that is really the case, and if that flight arrived, why was it given permission?
I mean, I have not seen all the details of the report. And when things like that happens, because of the quick time in which it happens, sometimes it's difficult. I think it may be a case where this flight was already en route, or persons that have already boarded or something like that. That may have been the reason why the flight landed. But of course, it just means that we had to be a lot more vigilant, and we have actually been a lot more vigilant with them, thankfully. And make sure that they keep the quarantine and test them, and make sure that they are negative both times we've tested them before we allow them to mingle. So it's still, like I say, it's still early. It's a very sensitive time for us. And we just have to make sure we keep our games up and going as best as we can.
All right, the cluster now. I understand today is retesting day for all of the is it that we're testing all of the almost 800?
Everybody, yes. Today is I call today D-Day. If ever there was a D-Day, today is
that day.
Right, because enough of the time have passed for incubation to have taken place. So really and truly, if today, at the end of the day, today, our country is going to face we're going to know for sure what we're dealing with COVID at the end of the day today. So I am actually very nervous right now. The officers are out there in the field, started very early this morning. We've been on them with the phone last night as well, making sure that they're ready for today, because apart from the cluster, we also have to keep testing the travelers as well to come out of quarantine. So in the life of our COVID response, today we'll be testing the most we have ever tested since COVID. So while I'm happy that we now increase our capacity to test, I'm also very nervous because by doing all of this tests we have to expect something. And I'm just hoping and pray to God that he continues to bless us as he has always been doing.
So let's round it off to 800. It's a little less than 800, yes?
I would say a little more.
A little more? Okay, so let's say 850. So all 850 swabs will be taken today and results maybe, let's say 24 hours?
Yeah, I'm hoping you could get within 24 hours. Certainly within 24 hours, we'll have an idea of what's going on. But for all the results to come in, all the checks to be done, all the controls to be run and so on, I would probably say 48 hours for us to have a full grasp of everything. Although in 24 hours, we may be able to have an idea of what we're facing.
There were one of the releases that came from the ministry late last week spoke of some Sandals guests that left before getting their results. And the question is asked, how is it that they're allowed to leave and they weren't in quarantine and they were allowed to go from whence they came? Can you explain exactly how is it that they were allowed to leave? And yeah,
you see, that kind of details is what I believe. I mean, I can't give the details, and I'm known to give sure details about what things are. And when I don't know for sure, I wouldn't want to speak too much about it. Understood. What I do know is that we have our systems in place, and I mean, let's face it, we have systems in place, we have policies in place, but not everybody follows those policies and principles. And we've always been saying to people, cover your face, wash your hands, and so on. But it left up to individuals themselves to do what they have to do. At the end of the day, we cannot police everybody. So I think there is space for improving the system. There is areas where we need to check up on and do better. And I believe that from that experience, we are continually tweaking our system to make sure that it is okay and that we continue to improve ourselves.
I've kind of lost track of adding the numbers. Overall, how many cases have we had between March and now?
Overall 90 plus, I believe. I don't know the exact number, and I mean, this thing is going to change. Even by the end of the program, now it's going to change, right. But very, very close to 100.
Well, it was past 100 last I checked, maybe late last week. I just haven't been able to get a grasp on the exact figure, but okay, we'll look into that. Another thing that I was concerned about or curious about our PCR tests. With this cluster, I know we've conducted thousands of tests prior. With this cluster, I heard we performed over 6,000 PCR tests. The question is, do we have enough PCR tests left, or is it that we're in search of supplies, PCR as well as other equipment needed for this time?
All right. Thankfully, at the moment, we're good. Thankfully, at the moment, we're good. But even if we're good, we've engaged PAHO last week and a couple of days ago in preparation for what we think could happen out of this current cluster, out of what's going to happen today. Worst case scenario, we've asked for support from PAHO. And we've been pledged those support. And as we speak, those supplies are actually coming in. I just spoke with the broker this morning, telling me that he's received confirmation that the supplies are here in some instances and on the way in other instances. But I'm thankful that as of this point, we are able to suffice with our testing capacity. I was a bit concerned that we may not have enough frontline workers to gather those swabs because, of course, once you start hearing frontline workers positive, then you worry about the other frontline workers. But thankfully to God, oh my goodness, the rest of our frontline workers are okay. And so we can continue the testing today. I mean, last time was a very stressful time for the ministry. We were up very late trying to get those tests done, make sure our frontline workers are okay to go out there this morning. And thankful to God they're out there doing the test this morning.
Are you able to identify which profession? Which profession of the medical team?
You're not going to get
a nurse, a doctor, a warden.
A healthcare provider.
Yeah, okay, fine. We're going to leave it at healthcare provider. Fair enough. With this cluster as well, the question of the toll on our health system comes into play. You just mentioned that we've had to increase our testing team.
Yes.
And what other repercussions have we seen from what is unfolding currently?
Thankfully, there is not any repercussions yet, except that the numbers are increasing. But the repercussions we expect is that if our testing today reveal widespread community infection, that will be the first repercussion, because it means that we now have to double up our resources in terms of contact tracing, getting people into quarantine, and testing them at appropriate time. So that will be the first repercussion that we're going to expect. Secondly, we have to expect, as we've been saying from the beginning of the pandemic, that 80% of your infections are going to be mild and asymptomatic, but 20% are going to be sick enough to enter hospital. That would be the next repercussion. Our epidemiologists now will have to start putting pen to paper to figure out what are the average numbers of people we expect to be sick enough to enter hospital. And then the third repercussion is to figure out in the hospital how we're going to deal with that 20% that we expect to come in. And from that 20%, we expect 5% to be sick enough to be put on a ventilator. How are we going to do it? Where are we going to place them? What if we have increased admissions? What are we going to do? We already have discussed it. We have a plan in place to deal with it. So those are the repercussions we're going to expect depending on the results of our testing today.
And another area of concern for parents specifically, this week as well, they sent out a news release. Well, for one of the secondary schools in St. David pointed out that one of their Form 2 students tested positive for the virus. Have we been able to identify how widespread it is specifically in the institution in terms of the contact tracing from that student?
Yeah. I mean, our contact tracing mechanism has worked thus far. The appropriate persons have been tagged, contacted, and tested. So that was okay. And we have not had a significant fallout from that particular situation thus far. So I believe that things are actually okay for the moment. We're just waiting for people to be cleared from the infection.
All right. Members of the public have been harsh. Well, they've been harsh from the start. But to me, the backlash has been greater over the past week as the cluster unfolds. They're really saying that the ministry has put us in danger and they need to apologize. And the blame game has started. How much responsibility has the ministry taken for the current cluster or the current unfolding of our COVID situation here in Grenada?
I think the Ministry of Health, at the end of the day, is responsible for the total health of the nation. So if you want to put it that way, whatever health outcome a country has is the Ministry of Health's responsibility. So from that standpoint, I will say the ministry has some responsibility and has some issue to deal with in ensuring that that everyone follow the rules as is. What I do know, however, is that the Ministry of Health has not been complacent or implicit in any kind of clandestine actions or motions with anybody at all. We, the Chief Medical Officer and myself, have always been very clear about what we think should be done. We've held steadfast to the fact that people need to be tested, masks need to be worn. At no point in time did the ministry collude with anybody or any institution or anything like that to break any of the COVID rules, because of course we are professionals at what we do. So I do, like I say, yes, the ministry has some responsibility, but what I would like to say, and I've said it from the beginning, since March we've been doing this thing, it is very simple and easy for individual to cast blame outside of themselves. And everybody does it, not just the rank and file citizen of their beloved state. Everybody else outside. It's easy for people to put it in because no one wants to do no introspection and to see what can I do or what did I do that contributes to what's going on here. So I am saying that from a health standpoint, we've always said health is your own personal business. Everybody, institutions, organizations, as well as people need to take some responsibility for what's going on with the health status of our country. The Ministry of Health overall continues to be steadfast with what we're doing. and we continue to ask people to follow the rules and protocols as set for COVID prevention.
Another conversation that I've heard as well, since we've banned flights from the suspended flights from the UK because of the new strain, we still have the situation unfolding in the US that they are the country with the most infections and now I believe the most deaths since the pandemic began. Are there plans or discussions taking place to suspend flights from the United States as well, considering their situation over there?
Just like we did in the beginning, the conversation is continuing, has continued. It's similar to what happened in the past. So the long and short of this is that, yes, conversation is happening, but more importantly, studies and looking at the data, looking at the status, looking at the whole public health response internationally is what is going to drive our final decision in what we do. So yes, we're discussing it and we're looking at it very closely. And at an appropriate time, after we've stratified our risks, then of course actions will be taken based on our risk stratification.
And do you have any update on one of the patients currently that developed pneumonia that the minister announced last Friday?
Thankfully, the patient is improving quite well, and we're happy with the response that we see.
All right, let's take a break and then we're going to come back and entertain questions from members of the public. This is To The Point, an update on Grenada's current COVID-19 situation with Permanent Secretary in the Ministry of Health, Dr. Francis Martin. We'll be right back.
When the devil want to breathe, we have to turn off. There goes again. He took me to a higher level, higher up. Oh, Daddy Father blessing me. Oh, Daddy Father,
the world is brighter. I'm so much lighter since you came into my life, Lord. I am not the same.
blessings flowing over here like a fountain. Don't make nobody trick you.
The National Disaster Management Agency, NADMA, reminds the general public to always be prepared. Make sure you have emergency supplies stocked away just in case. Here is a list to help you and your family. At least 1 gallon of water daily per person for 7 to 10 days. Enough food for at least 3 to 7 days. Non-perishable packaged or canned food and juices. Special items and food for babies and the elderly. Non-electric can opener. Cooking tools and fuel. Paper plates, plastic utensils, paper cups, trash bags and duct tape, useful for cleanup or patching leaks in an emergency, blankets, pillows, first aid kit, medicines, prescription drugs, toiletries, hygiene items, moisture wipes, tarpaulin to cover holes if needed, bleach, water purification tablets, flashlight with extra batteries, battery-operated radio, cash, small bills. Banks and ATMs may not be open or available for extended periods. Keys to house and cars, toys, books and games. Important document in a waterproof container or watertight resealable plastic bag. Up-to-date insurance, medical records, bank account numbers. Keep important phone numbers here. You may know them, but a loved one may not. A pocket knife, nails, a hammer and a rope are important elements. Towels and buckets are useful too if you develop a leak. Vehicle fuel, keep tanks filled.
A message from the National Disaster Management Agency, NADMA.
Welcome back to The Point, speaking with Permanent Secretary in the Ministry of Health, Dr. Francis Martin. At this point in the program, we are going to invite our viewers and listeners who may have comments, questions, queries, concerns to respectfully do so this morning. Landline 435-2041. WhatsApp is also 435-2041. Please, only written messages on WhatsApp. You can also ask your questions on Facebook and YouTube. Let's go to our first Caller, good morning, caller.
Yes, good morning, Citizen Welsh. Greetings, season's greetings, should I say. Listen, next year we had a talk on the significance of respectfully. But for now, I want to ask two questions of the goodly doctor there. Now, you asked him a question about the total of the people who have so far fallen ill and have contracted the illness, the virus and illness in the country. And his answer was 90 plus. I'll tell you this. This is not sufficient, doctor. I need to know, the people out here need to know the number. And we're coming from a senior officer in the Ministry of Health. You need to be more precise than that. Can you get some information from your people and let the people of Grenada know how many people in total have contracted the illness from March to now? 2. In recent times, it was disclosed in a press conference that the total tests generally done in the country was 11,000. That was last Sunday. On Friday, no, not last Sunday, but the Sunday prior. Last Friday, we were also told, given two numbers from someone there, I can't remember, it was so-called minister, 15,000, and then a couple of minutes after, 18,000. Can you tell us precisely how many tests have been done and the categories, be it PCR, and what's the name of the other one, rapid tests, etc.? Thank you very much, and do enjoy your holidays, albeit under the circumstances.
Thank you, Citizen Rollo. Doc?
All right. So what I'm going to do, I'm going to get in touch with the Chief Medical Officer and the Director of Labs to get some very, very accurate number. But what I would like to say is that what I don't want people to get tied up on is numbers per se, but focus on the disease and how we can protect ourselves from the disease. That's what I would like to say for now. But I'll get the numbers and let you know shortly.
Okay, so while you try that, let me see if I can put a little bit of information. According to the Worldometer, which is the website that is tracking infections, they have Grenada at 54 active cases. However, locally, the ministry released yesterday that we are at 59. So I am adding that 9 to the 54 that they have. And overall, they have us at 103 in total. And I'm also adding the 5 that they're missing from our active cases and brought it to 108, which is around the number that I calculated mentally following, I believe we were at 104 just late last week or earlier this week. So for now, it's 108. Citizen Rollo also asked about the number of tests. That's also part of the figures that you're trying to get to.
Yeah, let me get the latest.
Okay, no problem. Worldometer has us. I'm going off of the information that I have on the website until Doc can get the official figures while he speaks with the CMO. Worldometer has Grenada conducting 6,781 PCR tests so far. But Doc would hopefully have those official numbers for us when he's finished with that telephone conversation with the CMO, with the Acting Chief Medical Officer, Dr. Sean Charles. In the meantime, let me take this call. And okay, never mind. Doc is back.
All right. So, I've just checked. The current numbers is 114.
All right. That's overall.
Overall, with 59 active cases.
All right.
Hopefully, by the end of the program, the lab may be able to supply with me the exact numbers of tests that was done thus far. Because I want to get it straight from the source. Because, as I said, that's how I generally like to speak.
Understood. We appreciate the effort as we go along. Let's go back to the phone lines. Good morning, caller.
Hi, good morning.
Morning. Go ahead.
All right, so I'm just trying to find out from Dr. Martin if the Ministry of Health has any intention of testing the airport workers because they are frontline workers as well.
Thank you very much, caller. Doc, plans for testing airport workers?
Right, and that's a very important observation and concern because through our contact tracing, And just generally through the epidemiology, airport workers and some categories of airport workers are also considered frontline. And so, yes, that discussion is on. In fact, yesterday I spoke with CMO, who has given him and told him that we need to do this, and they are down to be tested at a time when we think it's best for us to be able to get the best result out of them. I cannot tell you the exact day they will be tested yet, but this decision has been taken to test them.
Somebody on YouTube is inquiring, I hear the comment that we shouldn't be focused on numbers, but why are we no longer receiving the type of updates we used to receive? And I would add to it, because I heard the comment as well, that the releases of updated information come out in the dead of night. Just last night's news release came out just about 11 o'clock, and that has been the situation for the past few releases from the ministry. So what has changed with the way the information is disseminated to the public?
Right, and I mean, I have to agree that the frequency of which we give information has changed from the beginning of COVID to now, and I believe we have to continue to improve our ability to hand over and give information as best as we can. We have changed our mechanism of how we do it, and I believe senior officers and our COVID committee and everyone is listening. If that's an improvement that we need to do for programs like these that I'm doing now, I know I used to do a lot more in the early days. So yeah, there is no argument there. There is some improvement that needs to be given in terms of education and information given out.
Another YouTube question, do we have access to remdesivir to treat COVID patients? I hope I got the pronunciation correctly. Remdesivir?
Yeah, our protocol would be based on our collegial interactions with our public health agencies in the Caribbean and the protocols that we get from World Health Organizations and so on. And what I can assure you is whatever protocol we're following, we have access to, and we'll be able to use it. Thankfully, though, the protocol we've been using thus far is working well, and everyone that has been treated has improved nicely on the protocol that we're using.
All right, let's go back to, hold on, let me see, the landline's not ringing, so let me go to a WhatsApp question. Somebody on WhatsApp is asking or saying, we know that things are subject to change anytime, but based on transmission we have seen so far from the current cluster, don't you think that it is testimony to generally good adherence to protocols by our people? Don't you think we should commend our people more and reinforce their positive behavior instead of just castigating them for non-compliance?
And the caller is right. We have to encourage people who have done right, and encourage those who are not doing those things that they should continue to do it. I have seen people follow the protocols. I'm happy about it. However, I have seen a lot of persons who do not follow the protocols, and not just for COVID, you know. I'm talking about infectious diseases totally. Dengue continues to be an issue on my mind that I've always spoken about, and the people's attitude towards mosquitoes in their surroundings. So yes, I really congratulate and hats off to the many, many citizens who have helped us along this way and help us to get to this point that we're at this moment. And those who are not following, I encourage them to continue to follow those rules and regulations, and including institutions and organizations as well who have broken those rules. I mean, I can't be in every place at every time, but I could only hope and pray that they're following the rules, and this current situation encourages everybody to realize the risk if they don't follow those rules.
Good morning, caller.
Good morning. How you doing?
I'm good.
Long time I haven't called this program. Doc, I'm just trying to, last night I was looking at a news clip last night with President-elect Joe Biden, and he said that he wanted to be honest with his people. And he was saying that the worst is yet to come. Yeah, meaning that the disease would be killing more people in the future before they get a handle on it. So people have to be careful. Now, in this country, it seems like people don't understand that. People think, well, they can go along with business as usual. You know, when America is saying that things would get worse before it get better, that's a serious problem. You know, and we are trying our best in this country here to put things in place. Yeah, but you have to understand. You have to be real with the people, make them understand. Like, you don't think, well, everything is a joke, you know. And you have to put them straight. The Prime Minister need to put people straight in this country here. Speak straight. You know, have a serious face. This is not a joke, you know. It's a serious business. So the question I'm asking is that, would things get worse? As President-elect Joe Biden said, would things get worse? Because you're a doctor, you must know.
Thank you, Cole.
Yeah, I have been clear from the beginning. It's the same thing I've always said. When we decided to open our borders, I started to tell people the worst is yet to come. If we thought we had a challenge before, the challenge is going to be much greater now. And that continues to be true. This current situation we're facing now is testament of the fact that we have to expect it to get worse before it gets better. In the next 24 to 48 hours after we get our results in from this current cluster, then, as I said, our country will seriously know what we are facing. And people must understand that and must practice the rules so that the rules become second nature to them. So you don't have to think to put on a mask. You don't have to think to sanitize your hand. You don't have to think to do what you have to do. Because we do expect, based on the way the world is going, we expect it to get worse before it gets better. And generally, pandemics, that's how they behave. If you look at the Spanish flu and yellow fever and so on, similarly, it gets worse before it gets better. And people really have to try and understand and remember that.
Doc, let me ask a question about the vaccine. We've seen the rollout of the vaccine in the UK, the US. Prior to the vaccine being officially administered, some of us were already saying, I ain't taking that. Now that the jabs are being given, we see people coming down with severe allergic reactions, and that is further putting skepticism in the rest of us who are considering taking the vaccine. Maybe what can you say to encourage us to take it if and when it becomes available, or to remind us to be patient and not make judgments at yet? What can you tell us to rest our minds when it comes to the vaccine and what's currently taking place?
All right. I've always said that my decision on the vaccine will be based on the science and the research and the safety of the vaccine. Vaccine is not new to human being and human generation. We have measles, mumps, and rubella vaccine that we now routinely give to our children. When this vaccine came out, I'm sure they had similar level of issues, people being cautious and so on about it. Once I'm satisfied that the vaccine is safe enough and that it wouldn't cause adverse effects in a way that is of concern, then I'll give a better understanding of this. When you talk about allergic reaction, if a vaccine gives an allergic reaction to 3 persons and 10,000 does not have an allergic reaction, what does that say? We have allergic reactions to shellfish, but does everybody stop eating shellfish because one person have an allergic reaction to it? We have an allergic reaction to antibiotics. Some people cannot take amoxicillin because they develop allergic reaction. What do we say? No one ingredient should use amoxicillin because one person have an allergic reaction towards it. I mean, practically, it really doesn't make much sense. We do expect a certain level, a certain number of people, and that's worldwide in science. That has been there from the beginning. Whenever there is a new treatment, whether it's an antibiotic or an injection or whatever it is, whenever there's a new treatment out, there are going to be some people who are going to have allergic reactions to it. The point is, in epidemiology, you look at the complete picture. If one person have an allergic reaction, but 10 million does not have an allergic reaction, then you look at the greater good. And that is how that's the kind of thinking I have going forward. But like I say, once we work with our partners, we look at the data, look at the science, look at the safety, then a decision will be made as to whether or not the vaccine will be used in this part of the world.
Let me go to Facebook. I haven't asked a question from Facebook. Somebody is asking, what about the rehabilitating of COVID patients? What is in place for them mentally and physically once they are medically cleared going forward?
That is an area of great concern. And thanks, caller, for making that observation, because, I mean, we recognize that is going to be an issue. We have started this process by engaging PAHO to assist us with the post-traumatic rehabilitation mentally of our patients regarding COVID. Even within our own staff itself, we've engaged counselors. In our quarantine sites, we've engaged social workers and counselors from the Ministry of Social Development to assist us with some persons who are having difficulty coping with it. I am not satisfied that we have enough of those counselors and psychiatric persons. I think we need more. If there are any volunteers out there who would like to volunteer with us who can help, we need to have all hands on deck. PAHO was particularly concerned about the mental health of our healthcare workers and our frontline workers. And they have done some training with us to help us in that regard. But the caller is correct. That's an area of concern that we as a nation needs to have as we go forward and deal with this COVID situation.
Another Facebook question. I know of a situation where someone was exposed. The whole family is quarantined at home, but they are waiting on test results from the person to whom they were exposed before the family is tested. Is this the norm?
That is not necessarily the norm, but what I would like persons to say, when you're doing in epidemiology and contact tracing, every situation is different. So there may be reasons why the family may not have been tested at the time, because it's about numbers, it's about days of exposure, and you test at the time when you're more likely to get a true result. So you cannot take one situation and compare it to another one when it comes to studying this epidemiology. It has to be taken on a case-by-case basis. I do hope, however, that this family of which she speaks would have been given the best advice, the best counseling, and that the test will be done at appropriate time.
Speaking of tests, a question on the YouTube as well in relation to awaiting results. Just over the weekend, the ministry issued a news release saying they were hoping to clear the backlog of tests and results that they had by Sunday. Have you been able to make any serious dent into the backlog of tests? Somebody on YouTube says they are in quarantine and still waiting their test. And I believe somebody on WhatsApp also pointed that out as well.
Yes, we have been able to clear the backlog, and that's really, really great news. Those who are still waiting on tests results, they are probably people who were tested on Sunday or probably on Monday, and so they have to wait for 24 to 48 hours. However, I have noticed that there are one or two persons who, for some reason or the other, their names, they were not called. If you are one of those persons who are listening to this program, it's not many of you, but I know there are some. So if there is any one of you listening to this program, kindly communicate with me so that we can get you your test. It may be that when they call, you were not at home, or you were not close to your phone, or something like that. Or one traveler actually called and said, the number that I gave them, that when I reached at the quarantine location, I realized the number was working. So he called to give a new number in the event that he's to be called. So things like that may happen, and hopefully it would not be too much of those, and you can reach out to me afterwards.
All right, let me see. The phone is ringing. 321. No. So let me go to a WhatsApp question. Dr. Martin, some people refer to the 8 to 5 curfew as the Nicodemus curfew who comes out at night. Question: Do you think the Prime Minister didn't go far enough because people are more outside in the day than in the nights, mingling with others? And what do you think should be different, or was mentioned by the Prime Minister?
Well, the Prime Minister acts on advice from the COVID committee. So, I believe that good deliberations would have happened with the COVID committee to give him the advice that he needs to. COVID is not a Nicodemus virus. But listen, but between me and you, there are reasons why this thing happened. Listen, in the day, right? You and I, we have to continue our life as normal. Now, of course, it's about balancing life and livelihood. We have to have a juggling act to balance and so on, because people must live. People have a better opportunity during the day to consciously do what they need to do. But listen to me, let's just face it, people drink a lot more in the night, and people are a lot more careless in the night. Most parties and so on happen in the night. So people's ability to control themselves at the nights, based on the exposure for alcohol and so on, that increases the risk. Now, I'm not saying this is a this is an excuse or anything like that. I believe we are facing a difficult situation nationally. And while personally as a physician, if you lock down the country from an epidemiological standpoint, it may work to stop the virus, but then people can't get paid, people can't go to work, and that effect can have very significant effects on us. And sometimes we must think about that when we see that those tough and difficult decisions has to be made. We have to have a balancing act somewhere in between.
Good morning, caller.
Good morning.
Good morning.
And how are you?
I'm good. Yes, go ahead.
Yes, I am. Okay, firstly, I would like to extend my greetings to the doctor.
Just turn the volume down on the television or the radio.
Yes, and okay. Yes, I was saying I would like to extend my greetings to the doctor and all those who have been fighting so hard to keep our island safe. Also to you, Blossom, for trying your best to extend the courtesy to the people and let them know that these things is very serious. And also, in the case of Sandals, I give the government a little blame, but Sandals are the one that not letting the workers wear their mask and do the things they're supposed to do. However, you continue along with your staff to do your best. Thank you very much. Have a Merry Christmas.
Thank you. You enjoy yours as well. Doc?
Yeah, like I said before, the rules have always been the same. People are to wear their masks, get their tests, but it's up to the individual to follow the rules.
There are two people on the WhatsApp asking about the reopening of schools, which is scheduled for January 4th, less than 2 weeks. I know the final decision usually would come from the Ministry of Education, but considering the climate, do you have any information as to if that's still the plan? Are we looking at a delay? What's going to happen with our children?
It all depends on the epidemiology. And I would say today is D-Day. Let's wait and see.
So what happens today will determine...
I'm telling you, what happens today will determine how this country is going to go in the foreseeable future, to be honest.
Understood. Landline? 3, 2, 1. Okay. Good morning, caller.
Good morning, Blossom. Could you tell me how many people came in from London, from England, on the 2 aircraft, please?
That's yesterday?
Yeah.
Okay. I'll follow up to the question that I asked this morning about did I had a flight from the UK? If you know how many people came in on the flight.
Subject to correction, it may be 13 or something like that, but subject to correction.
And were they all Grenadians? All nationals?
I'm not sure. Okay. I'm not sure. The chief medical officer is now calling me. Give me a second, let me hear what he has to say, because I'm pretty sure he may have to do something with this program.
No problem. Let's keep our fingers crossed in the meantime. Go ahead, Doc. While the doc does that, let me take this caller, write down the question, so when Doc is finished, he would be able to address it if he can. Good morning, caller.
Hi, good morning. I just want to personally thank Doc for his commitment to this fight. Thank you for always answering your phone, especially on Saturday mornings. Continue doing a great job, and I trust in terms of communication that we see improved communication. Thank you.
Thank you very much, caller. Doc, high commendations. And I would join it as well to say thanks for always answering the calls. I know in the newsroom, when I call for appearances from an official for To The Point, you all are always willing. So I would join the caller to say thank you so much for your dedication. Right, so the CMO had information for us?
No.
Okay, all right. Just check it. I had to take in front. All right, so let me ask this Facebook question. Somebody on Facebook, I just saw a Facebook question, right? How did Grenada come to be classified as one of the top 10 poorest countries in the region to qualify for free vaccines?
Oh, the vaccines are not free, The vaccines are not free. It's just that over the years we have really put together a nice mechanism for getting our vaccines. And that is through PAHO. There's a mechanism in there that we've been using in PAHO for us to get our measles, mumps, rubella, yellow fever vaccine, hepatitis vaccine. And it's just that in anticipation of what may have happened, or in anticipation of what we thought the world thought will happen with the new COVID vaccine, our regional institution preempted this and started to put things in place long before the vaccine was made, so that that facility will also be used for us to get the vaccine. There's a lot of money that has to be paid for the vaccine, but because that facility with PAHO exists, then Grenada doesn't have to take money out of his pocket to get the vaccine right away. But there is a mechanism in place for the vaccine to be paid for. So it's not free. It is something that that has been funded and that Grenada has to be part of. And it's going to be part of our vaccine facility from them anyway, the vaccine that we get for tetanus and all this other vaccines.
All right, I think that would be all we have time. I'm scrolling my eye through the WhatsApp to see if there are urgent questions that I need to ask the PS before he runs off.
And for Mr. Rolo, I really would like to get that number for him. I made a commitment. I have not gotten the answer yet. So, Mr. Rolo, I don't know if you know my number or whatever it is. As soon as I get any information from the lab, I would really like to furnish you with it because I made a commitment to do so.
Okay, and somebody is asking that now that we see Cuba has given approval for the vaccine by WHO and PAHO, has the government considered sourcing the vaccine from them? The final decision on which vaccine Grenada uses for its citizens comes from the WHO, or we make that decision here? Let's say there are 3 available, Moderna, Pfizer, and the one from Cuba.
Right. The final decision will be based on recommendations from our public health agencies in the Caribbean, PAHO and CAFA.
So it's not necessarily that all Caribbean countries will use the same one.
It's possible that all Caribbean countries may not use the same one. As a matter of fact, I think for diversity and because of people's different reaction and so on, from a medical standpoint, it would be useful for us to do a combination. But, I'm not so sure exactly how it's going to work out at the end.
Understand. Just wanted to have that knowledge. Well, Doc, thank you. Any final words as we go further into D-Day, as you call it?
As D-Day approaches, I want to encourage the nation to do what we said to do from the beginning, which is know your status, know what's happening around you. Continue to keep your hands clean, wash it all the time. Use your face mask appropriately and well. Exercise and continue to eat bright colored foods to improve your immune system, especially now that the world is facing this new that new infection. It is even more time for us to improve our immune system by continuing to eat our bright colored foods as much as you can and decrease the use of meat as much as you can, eat more fish so that you give your body the best chance of coping with this virus. And unfortunately, if the new one hits our shores as well, give your body the best chance to fight it.
Doc, thank you so much. And of course, we'll be calling you as the day progresses as we go further into D-Day. So look out for the newsroom. Thank you so much. And have yourself a safe, enjoyable Christmas and continue to do what you're doing to stay COVID-19 free.
Thank you.
All right.
Bye-bye.
Permanent Secretary in the Ministry of Health, Dr. Francis Martin, giving us an update on Grenada's current COVID-19 situation. Somebody on the WhatsApp was asking if they would that they are in quarantine. Today is day 4. Will they get tested today? That is usually the plan. Usually day 4 or 5 is when the calls are usually being made. But considering our current climate and with over 800 tests to be carried out today specifically, let's keep fingers crossed that you will be contacted today to take your swab and your test and you can get out of quarantine just in time for Christmas. Let's hope for the best. That would be the end of my time with you for today. Joseph is up next. He told me to call him Mr. Joseph is up next with the Christmas Caravan. Have yourselves a safe, enjoyable Wednesday. Stay safe, observe the protocols, and I'll be back tomorrow, God willing.